So in a nutshell, the best prevention measure often have nothing to do with substance use itself. We discuss stigma reduction, we discuss upstream prevention, we discuss so many examples that are not directly related to substance use. And actually, by doing so, we can improve overall health and well-being. So we can have like outcomes or consequences on other aspects that might be also great. And then we can also reduce social and health inequity. Effort to prevent substance-related harm among youth must reflect individual school communities, organization, unique need, value, preferences, and context. So we really need to adapt these to what works for you, to your specific context, and what is happening in your community. Engaging with teacher, family, school health nurses, other school staff, youth themselves, other organization might help to do so. So if we come back here to our blueprint for action and trying to combine the 4 intervention strategies and the comprehensive school health framework, this is what we're getting at. So these elements may appear much mutually exclusive, but they have more similarities than it looks. First, they share the same values: compassion, equity, and responsiveness. And they can look the same in practice. And that's a bit what this chart is trying to achieve, is trying to see what are the overlap and how can we keep these all in mind and then find strategies that might fall under a few different components. So here we filled a few boxes with examples, which might not be a good example for your specific community or specific organization, but it's just, maybe it's going to spark some ideas. So for example, when we look at upstream prevention and social and physical environment, we have providing resources, encouraging and spaces that students who are keen to start a new club or students group organize event, etc. So really encouraging students to have initiative. In policy and harm reduction, we have to implement naloxone kit available and accessible in all the schools or all the organization. If we look at teaching and equity-oriented intervention, we have offering diversity and inclusivity training for students and staff to increase knowledge of diverse identities and situation and contributes to individual unique lived experience. So these are, again, only a few examples that we put together just to illustrate, but take the time to use that chart, which you'll have a blank chart at the end. So take the time to use that chart and to really do the exercise, think through how we can implement these strategies. If you're not convinced yet about how amazing this model is, I have 5 reasons why you should. So the blueprint for action is relevant, feasible, and actionable because first, it affords a greater reach and relevance to youth compared to a one-size-fits-all model. So as we have seen through all the approaches that we discussed, there are a lot of flexibility, a lot of adaptability. The blueprint for action is not a recipe. It's not do step 1, 2, and 3, and then all your problem will be solved. We do not pretend that it will be easy like that. It really hopes to be shaped in the best way for your specific contexts, which then may feel more relevant for youth themselves. Second, when applied in combination, the model building blocks can support and reinforce each other. So as we were saying, there is a lot of overlap between the comprehensive school health framework, the different approaches, intervention approaches. So really by putting a strategy, for example, in harm reduction, we might be also putting a strategy for stigma reduction, and putting a strategy for equity intervention might reinforce that stigma reduction strategy and and then also the harm reduction strategy. So really, they will reinforce each other. They will work together to achieve greater goals. Then the 4 intervention approach have broad relevance. So like I was saying, they are so flexible that and so adaptable that they can be applied for other aspects than just substance use, health in general in your school, and then have really be relevant for more things. This model can contribute to a range of positive outcomes for school communities. So if it has broad relevance, we might fall under other aspects and then have a better sense of belonging, have better retention in school, better academic success, better mental health. So many other things that are obviously great and then can also affect substance use itself. So we have to keep that in mind as well. And finally, this model reflects a much needed shift away from statu quo. What we're doing right now isn't working, and any step to change will be a step in the right direction.